Hello friends, welcome back to the second part of Pharmacology of Emesis. The last video was the first part of Pharmacology of Emesis. The link of the first part is in the description below. Do watch it for better understanding of this video. So, today we will discuss different drugs which are used to control emesis and the rationale behind using them. The term antiemetic is used to describe the drugs which prevent or manage emesis. Friends, this figure demonstrates the centers which are involved in vomiting reflex, and these centers are namely vomiting center, chemoreceptor trigger zone, and vestibular nuclei. These centers are activated when the receptors present on them are stimulated. Let us recall the receptors present on these centers. Muscarinic type of receptors are present on vomiting center and on vestibular nuclei. Histamine 1 type of receptor are present on vestibular nuclei. Dopamine D2 type of receptor are present on chemoreceptor trigger zone. 5-HT3 type of receptors are present on chemoreceptor trigger zone as well as on vagus nerve endings. These are the obvious targets to control or manage emesis. Now, let us see the drugs which prevent activation of these receptors. First class of the drugs that we are taking up are anticholinergic drugs. This class of drugs prevent activation of muscarinic receptors. Hyoscine and dicyclomine are the drugs that come under this category. Moving to the next category, which is antihistaminic drugs. These drugs prevent the activation of H1 receptors present on vestibular nuclei. This class of drug is mostly used for treatment of motion sickness. As you can observe from this figure that the vestibular nuclei stimulation caused by vestibular nerve, which plays a significant role in motion sickness. When this nuclei is stimulated, it causes vomiting reflex. The H1 antihistaminic drugs are promethazine, meclizine, cinnarizine, diphenhydramine, doxylamine, and dimenhydrinate. The next class is of D2 receptor blockers, which are also known as neuroleptics. The drugs which comes under this class are chlorpromazine, triflupromazine, prochlorperazine, and haloperidol. After this comes the next category, which is antagonists of 5-HT3 receptors. As discussed previously, these receptors are present on chemoreceptor trigger zone as well as on vagus nerve endings. These drugs prevent the activation of 5-HT3 receptors, and the drugs are ondansetron, granisetron, palonosetron, and ramosetron. Besides these categories, there are some other class of drugs which are also used to control emesis, like prokinetic drugs, NK1 receptor antagonists, and other drugs. The prokinetic drugs are the drugs which promotes gastrointestinal transit and speed up gastric emptying. Thus, it prevents emesis. Drugs which comes under this class are metoclopramide, domperidone, cisapride, mosapride, and etopride. The next class is neurokinin 1 receptor antagonist. These receptors have gained importance in recent time in treatment of emesis. Drugs which comes under this category contains prepitant S suffix. Examples are aprepitant and fosaprepitant. Some other miscellaneous agents which are used as adjuvant antiemetics are dexamethasone, benzodiazepine, dronabinol, nebilon. This is the complete summary of antiemetic drugs. This is all from Team Enantiomers. I hope you all enjoyed the learning session. This video has been created and conceptualized by Sanjay Yadav and Rahul Dixit. Please share the topics on which you want us to make the videos. And yes, please do not forget to like, share, comment and subscribe our channel Enantiomers. Thank you very much.